Cerebral vascular accidents, part 2. There is some repeat information in this PowerPoint. Please bear with me. Stroke is a loss of blood flow to the brain, resulting in loss of oxygen supply, causing death to brain cells. The two basic types of stroke are ischemic and hemorrhagic. In an ischemic stroke, there is occlusion of cerebral arteries causing damage to brain tissue, which are dependent on the blood supply from the affected vessel. It is the most common type of CVA, and if the clot is not dissolved, the patient may suffer secondary insults. In a hemorrhagic stroke, a cerebral artery leaks blood, which damages adjacent brain tissue. It is usually more severe than an ischemic stroke because it not only blocks the flow of blood to the area controlled by that blood vessel, but it also damages the brain tissue from pressure from the leak itself. This is most likely caused from an aneurysm or some type of hemorrhage. So you can see that though the causes are different, a leak or occlusion, the result is the same. There is lack of flow. This is actually potential to cause damage if there were electrical wires here or if it was in a tight space like in your skull, causing further damage at the site of the leak. Controllable risk factors are hypertension, controlled by medication and diet, and maybe even stress management, cigarette smoking, difficult to treat, of course, excessive alcohol intake, high cholesterol level, and obesity. Uncontrollable risk factors are increasing age, which, similar to hip fractures, the risk is double for every 10 years over the age of 55. You certainly cannot change whether you are male or if you are African American. A personal history of diabetes, whether it's controlled or not, and personal or family history of stroke or TIA. The side of the brain the stroke is on is indicated by hemisphere, and the side where the paralysis is located is the hemiparesis or hemiplegia. The difference is hemiparesis is weakness and hemiplegia is paralysis. Medical professionals oftentimes will refer to a patient as left hemi, and they don't indicate whether they mean the side of the brain or the part of the body. Make sure they clarify before you answer any questions. The carotid arteries supply the anterior portion of the brain. This includes most of the cerebrum. The vertebral arteries feed the cerebellum and the brainstem. Aphasia is most often associated with left brain hemisphere, so with right-sided weakness, the patient may experience aphasia. Neglect is most often associated with right hemisphere strokes, so expect a patient with left-sided weakness to have neglect. We often call patients with neglect, or not the patient, but the problem, left neglect, because that's mostly when you will see it. I created this slide to try to help summarize the difference between a left CVA and a right CVA. Pay attention to the areas in bold. They may be important. Dominance may affect outcome. You're not responsible to know this, but I would like you to understand that the reason that a patient with right hemiplegia probably has aphasia is because most often people are left hemisphere dominant. However, a small percentage of left-handed people are right hemisphere dominant, and so they may have aphasia if their right hemisphere is damaged. If your patient has left-sided weakness and aphasia, which is not the norm, Find out if they are left or right-handed. That would be helpful to understand their symptoms. Okay, so there's no stars here, so you just need to be aware of this, maybe to help you with the next slide. The middle cerebral artery is the largest vessel branching off of the internal carotid artery. It is the most common site of occlusion. The middle cerebral artery feeds an enormous territory of brain, the frontal, temporal, and parietal lobes. It also feeds the basal ganglia and the internal capsule. The MCA has a main stem and several branches, so the amount of damage will depend on if it's damage to the main stem or the smaller branches. Distribution of the middle cerebral artery is so large that a stroke of the main stem puts the victim at risk for severe disability or death. In contrast, occlusion of a middle cerebral artery branch damages a small brain territory and causes less severe disability. The hallmark of an MCA stroke are, sorry, I was going to list these things. So the hallmarks of an MCA stroke are the focus of most public awareness messages. So most commonly people will notice or describe a stroke as facial asymmetry, arm weakness, and speech deficits. A complete MCA stroke causes hemiplegia on the contralateral side, mostly affecting the face, arm, and hand, and it largely spares the leg. We will see a diagram of the cerebral cortex and how this lays out. There's also sensory loss to the contralateral side, so the same side that the paralysis is on. So don't confuse this slide with opposite to the weakness. And then patient demonstrates contralateral hemianopsia. So in each eye, they lose visual field on the opposite side of where the CVA was. In middle cerebral artery strokes, this is due to disruption in the visual pathway, so not the occipital lobe. The anterior cerebral artery supplies the anterior medial portions of the frontal and parietal lobes. It is the least commonly affected stroke by stroke. The classic signs are contralateral leg weakness and sensory loss. Behavioral abnormalities, which, if you remember from your anatomy class, the frontal lobe is pretty much a personality and judgment area. So since the frontal lobe is anterior, and we're talking about the anterior cerebral artery, that may help you to remember behavioral abnormalities are associated with anterior cerebral artery. I could say it again, but I won't. And incontinence may occur as well. Posterior cerebral artery feeds the medial occipital lobe and inferior medial temporal lobe. So really focus on the occipital lobe being posterior or in the back of your head. If you don't remember that, this will help you to remember where the occipital lobe is, but hopefully you already know where that is, and it'll help you to know that vision is primarily affected. So though we see in middle cerebral artery some hemianopsia, this visual loss is directly because of occipital lobe decline. So larger posterior cerebral artery strokes may cause some hemiparesis and sensory loss, but less commonly than a middle cerebral artery. They also can cause aphasia, whereas right PCA strokes cause neglect. Okay, so the cerebellum. If I don't know if you learned this in anatomy, but it is, uh, yeah, we won't look at that. Commonly impairment of balance and coordination. So the cerebellum is really responsible for coordination, and so patients with ataxia most likely have a cerebellar stroke. Now, it's common to have some ataxia, but you will see especially upper extremity ataxia in a cerebellar stroke. A stroke of the brainstem is a very serious medical condition. Patients are likely to be critically ill and may require intubation. Okay, so this we call this the homunculus, and some of you don't remember that term, and it's just the name given to this silly-looking person created on the sensory motor cortex. So the motor cortex is in the frontal lobe, and the sensory cortex is the beginning of the parietal lobe. And so this piece of cortex here is comprises of just half of the brain, one hemisphere. So there's a complete repeat of this same cortex on the right side as well. So this does not span across the whole brain. This is just one hemisphere. Um, and it matches pretty clearly the with the sensory cortex. Now you can see that we have a little bit more motor on the motor on in this cortex than in the hand, but the face is fairly similar. Oh, and that's it.